Hand hygiene. What's stopping you? We all think that our hand hygiene practices are good, but are we really as good as we think we are? Watch this animation to find out what's stopping people doing hand hygiene. Everybody working in health and care in Scotland has a role to play in making a real difference to infection, prevention and control by performing hand hygiene at the right times and in the right way. Hand hygiene isn't difficult, but it's not always performed correctly. So why not? And what's stopping you? Let's take a closer look. Here is one of our cleaners. She has been working for the NHS for 20 years. She is proud of the fact that she has never got sick or picked up an infection from anything or anybody at work. But hand hygiene is not just about protecting yourself, but protecting others. She could have still infected others by not performing hand hygiene. Here is one of our nurses. He tries hard to perform hand hygiene before and after touching anyone in his care or anything that they have touched. But there are critical times when he doesn't perform hand hygiene. He struggles with constant disruptions and urgent tasks to attend to and doesn't always perform hand hygiene every time before he touches someone in his care. This care worker used to perform hand hygiene a lot. So much so, her hands are now very dry and itchy from a particular soap that she used. Now she tends to avoid hand hygiene whenever she thinks it is okay. When the doctor hears there has been an outbreak of flu, she is extra careful and performs hand hygiene at every given opportunity. She doesn't want to catch it. But when there are no outbreaks of infection, she copies someone else and performs hand hygiene less often. This dental nurse wears disposable gloves to protect herself whenever she can, but she keeps them on when there is no need to, putting patients at risk by missing key moments for hand hygiene. This porter knows exactly when he is supposed to perform hand hygiene, but sometimes factors that seem out of his control prevent him from performing hand hygiene. If he looks, there's usually a simple solution. So what is stopping you? Think of it like a war against infection, and you are in the front line. Your actions can stop infection spreading to people in care, to you, and to your family. Performing hand hygiene should be like brushing your teeth. It needs to be done consistently, correctly, and regularly, every day and every time. Everyone is busy, and there are so many other important things to do, but hand hygiene is important. You need to stop and think, and take the correct actions to save time dealing with infections. This is everyone's responsibility. So what's stopping you?